information on prevention, tools for a healthy lifestyle. Make little changes to be the best you. It's all here. A podcast empowering, informing, and motivating Bermuda to live well. Bermuda Health-Abets. Everything from A to Z on healthy living. Brought to you by the Health Promotion and Wellness Office of the Department of Health in collaboration with local health partners.
Welcome to another episode of Bermuda Health-Abets, a podcast where we discuss everything from A to Z on healthy living with the mission of empowering, informing, and motivating Bermuda residents to live well. I'm your host today, Yosefia Spence, the public health educator at the Department of Health, and I want to welcome you, our listeners, our Bermuda Health-Abetters, and I want to welcome our special guest today, Nicholas Darcile, did I say it correctly?
Nicholas Darcile.
See,
everyone has a problem with that name, Yosefia.
I practiced it for a few minutes, and then I still got it incorrect. So, Nicholas Darcile, can you give us a bit of your background, and what organization you come from, and tell us a little fun fact or something interesting about yourself?
Okay, those questions are really always interesting. Well, my name is Nicholas Darcile. I'm originally from Trinidad and Tobago, the lovely island of Trinidad and Tobago. I found my passion in mental health nursing, and that was an interesting journey for me because I was pushed into it. Okay. My mother said, you have to do a profession. You can't just be working constructions and factories and you're going to do mental health nursing. But I fall in love when I really was able to see that the system works. That people can actually get back their lives. People can live more fruitful lives and have that revolving door syndrome in and out of hospitals. And that's where I found my passion in rehabilitation, mental health rehabilitation. Okay,
so that's your professional background, is
yes.
mental rehabilitation?
Yes.
You're a registered nurse?
So I'm a registered nurse. I'm also a registered addiction counselor.
Okay.
I'm also a registered mental health first aid facilitator.
Okay.
And I'm a director, one of the directors of Dignity House.
Okay, so I am a certified mental health first aider, adult mental health first aider, and I'm actually a newly trained facilitator for youth mental health first aid.
Ooh.
All right, okay. Look at us. More people becoming aware and trained in the community is what's important.
Yes.
Right? You don't have to have a mental health background to get trained in mental health first aid.
No.
So listeners, if you're interested in mental health first aid, adult or youth, find out how you can get that certification, and I think that will help us in our everyday lives. So today,
I must say, that Dignity House also train people to be mental health first aid certified. So if you need that certification, all you need to do is reach out to us, join one of our training days, and you can really learn how to save someone or support someone of a mental health challenge.
Yes, thank you so much. I know that BHB or Mid-Atlantic Wellness Institute, they also have a mental health first aid courses as well.
Yes.
So just to get into our topic today, which is alcohol abuse awareness, understanding the history of alcohol use and the resources that we have in our community to help those who battle with alcohol addiction. And so you said that you're from Dignity House. Can you tell us what is Dignity House?
Thank you. So Dignity House is a residential mental health facility focused on rehabilitation. Most people say you can't be rehabilitated from mental health, but if you break your hands, that pulling, that tugging, that twisting, those days that you don't want to go to the doctor and that you go and your hands become back to the original status or almost the original status. Mental health is the same. Mental health rehab at Dignity House, we have psychiatrists, psychologists, occupational therapists, recreational therapists, nursing, and a range of activities that help support people back to wellness.
Okay, thank you so much. One thing I always say is that we all have mental health. Now, the state of our mental health is what varies and what makes a difference in terms of if you're experiencing mental health challenges or if you have a mental health diagnosis, right? So we all have mental health. And I think the whole component behind rehabilitation looks at how functional are you on a daily basis. So I feel like that notion that there is no rehabilitation or recovery, I think that we have to reconsider how we think about that. So when we think about alcohol abuse, can you just give us a bit of what the history is around alcohol use? Like, what were some of the earliest known uses of alcohol, and how has the perception of alcohol consumption changed from, like, for instance, prohibition to now? And then what are some major events in history that influence alcohol production, and how culture and attitudes towards alcohol differ among various societies? Because, we're in Bermuda, so. And you know what you said, you're from Trinidad. So, I know that there's also a background when you think about the history of alcohol.
Definitely. In Trinidad, they said Trinis love to drink. And that's surprisingly because most of my clients, clients who challenge with addiction, said Bermudians love to drink. And I remember that terminology in Trinidad. However, in the history, alcohol is amazing. It backs straight back to 7,000, 5,000 BC. That's before Christ, where we had the Greeks and the Egyptians that used alcohol, and they use alcohol mainly for recreational, for medicinal purposes, and coming forward. And we can talk about even the U.S. history, where people started to drink a lot. But let's track back a bit. We had alcohol as being distilled alcohol. That's where they're able to extract the main ingredient from alcohol and make it more concentrated. Distilled alcohol, people was very expensive, so therefore only persons with money would drink alcohol, and they call it gin. That's where you got the gin from.
Oh, okay.
Obviously, people can get alcohol through fermentation. So therefore, what we call the poor persons actually fermented the alcohol and from fruits. So they had their own alcohol drink too.
That's where you got the wine.
But that's
right?
Yes. So the drink was alcohol. So we had alcohol gin, which was very expensive, and alcohol fermented wines. Going back in history, in America, they realized that with increased consumption of alcohol, that no one was coming to work, that they had an increase in domestic violence. They have an increase in people not paying attention to their basic needs. Now, from a small scale, that's okay. But if you have a country doing that, therefore there's a depletion in the human resources.
Yes.
And a depletion in the human resources means, that the basic element of the fabric of society wouldn't be able to be functional. So between 1922 and 1933, there was a gap where alcohol was where alcohol was stopped. By law, you couldn't use alcohol.
Right, so that was prohibition.
And during that period, the government found that the society started to be functional, that people started to do their work. So that goes to show you the effect of alcohol and how the government realized how it was it wasn't positive.
Right, so it's a morality kind of thing, and that the fabric the very functioning component of society would have been affected by overuse or abuse of alcohol consumption. So they banned it altogether.
Yes.
Right.
But there was a group saying, listen, we don't need to ban alcohol. We could be temporal. All right. So let's be temporal. Let's put things in place. Let's restrict people consumption and let's make it public again. Because after all, it was everybody liked to knock their glass and it was a very social event. So the government in the 20th century, the alcohol started to become more popular and a drink of recreation once more with some level of restrictions.
Right. And again, I was drawn back to, and correct me if I'm wrong, the fact that as well, the reason they brought it back was kind of the impact that it had even on the increase in organized crime and violence as it relates to prohibition.
My accountant friend once told me, if you ever want to see what decisions the government make, follow the money.
Right.
So from a place of alcoholism, there was a lot of people, alcohol was accessible, was expensive, people were possibly addicted to it. So there's a lot of people spending finances behind alcohol. And then you have all the taxes that the government would take from the society for people who use alcohol. So all those were beneficial factors in terms that helped that
would be
culture.
the reasoning why they would make it legal again.
Yes.
Right. So when we think about, so we have the history and the background of kind of the alcohol use and some ways in which we use it in society, typically socially. But what we're looking at today then is that overconsumption and that abuse of it, right? So when we think about alcohol and alcohol addiction, what are some stages of alcohol addiction? Like, what are the typical stages of alcohol addiction from initial use to full-blown dependence? Because we're talking about, we're not just talking about the recreational use of it, right? We're now talking about how it can impact an individual and our society.
That's a good question. So before we look at the stages of alcoholism, we can possibly look at the stages of change. All right. So we have the pre-contemplating stage where, you're drinking alcohol and, your alcoholism and you're alcoholic. You're drinking alcohol and your family members asking to change because they see that you're unable to cope. And you have the pre-contemplating stage where you're saying, I'm not ready. I don't need to change. Then we move on to the contemplating stage where you're saying, I know I have a problem. I know that it impacts me, but I am not ready to change. Then we move on to the preparation stage where you're saying, I can see that I need to change, but I need to put some things in place. I'm not really ready to change yet. Then the active stage where you actually starting to make the change and family members are excited because they see that there's a lot of change in you. Then you have the last stage, which is the rehabilitation stage, where the change is made and you need that extra support, to keep you on your feet and to maintain that change.
Yeah, so that's very near and dear to my heart. You talked about the theory of just change, stages of change, which is very interesting because we look at that when we look at behavior change a lot in public health. And you will know that also a lot of times, a lot of the theories, because there are so many theories of change, look at a cyclical component in that you can go from any one of those stages at any point and kind of go back around.
Yes.
Right. And so that's very interesting. But you talked about that cycles of addiction. But my question is kind of how you even get to that point. What are some of the things that influence alcohol abuse, right? Because we're looking at, and what you've just described is that stage of kind of getting to a point where there's a recognition that there is an alcohol abuse issue. But before you get there, because how do you get from the social aspect of I when I go to a party, maybe once a month or every other week, I have one or two drinks. How do you get to the aspect of alcohol abuse? What defines what alcohol abuse is or addiction?
Okay. So
If you can answer that for me, sorry.
Normally, let's start at the abstinence stage. The person doesn't want to drink. I grew up in a Christian faith and I don't want to drink, or my family wasn't exposing to drink, to alcohol. I don't want to drink. But your friends are saying, taste it. It's okay. You're going to like it. So you reach to the experimental stage where you're gonna experiment on it. You're not gonna get hooked. You're not a drunkard. You're not not an alcoholic. You're just gonna experiment. You're just gonna see what it tastes like. And initially it's bitter, or you want to know why people drink in this bitter taste. Why can't they drink juices and strawberries? But eventually you start liking the taste, and you'd start moving from experimental to social. So I'm hanging out with my friends, as you rightly said. Somebody give me a couple of beers, and that's what socially accepted. So I'm going to a party, I drink 2-3 beers, and I'm happy. And for me, it's hanging out with my friends. It's socially accepted. I'm part of a group now. I'm not just sticking out and saying, "Give me a juice" when everybody is drinking. So I'm happy. But in that hanging every Friday night or every weekend, I realized that after Friday night that I'm feeling for a taste Monday, Tuesday, Wednesday, and for a little period of time, that's okay. It's like, I still had one beer a day wouldn't destroy me. So I'm fine. But the day I don't have money, and I said, you know what, I'm going to ease off the beer today because I'm not going to the shop, or I'm not feeling to drink today. And I realized that craving is overwhelming. That I'm not only psychologically, that I have now a psychological dependence on alcohol. Okay? And I can't shake it. Or I realized that while I want to stop, my hands have started to tremble. So I've started to experience what they call delirium tremors, or I start feeling nausea and vomit. So I need, and the only thing that stops that is the drink. So I now move from abstinence, from experimental to social. From social, I'm now dependent on the drug. I'm now dependent because despite my not wanting it, I've lost control. I'm no longer in control of that vehicle, my body, my life, what I want to do. I've lost control. And from that losing control, you started to drink more, and you go into that denial. That's not gonna me. I got this, and you realize that you absolutely lost control. You wake up, you have to have a drink. You go to bed, you have to have a drink. Throughout the day, you start going to the bar, going and having a drink with your friends and normalizing it because you cannot stop and you're too ashamed to ask for help. Finally, you have the addiction phase where despite losing your job, despite the alcohol causing you impotence with your wife and you're struggling with that intimacy because it's not happening. Beside the alcohol, you're gonna lose your wife, your children, you have problems driving, you got in a couple of accidents, you're going blackout. Despite all the physical or psychological factors, you still want to drink. Right.
So when we think about that, right, as well, because now we're thinking about it graduating from like experimental to social to then potentially becoming to abuse, then potentially becoming addiction, right? And thinking about that, I wonder what then influences that, because I know when we think about society, right, when we think about how we live, and a lot of times what alcohol is used for is really it's as a coping mechanism, which is an unhelpful
Self-medication.
coping mechanism, because when we think about managing stress or life, we think about what are helpful coping mechanisms versus what are unhelpful coping mechanisms, and we think about alcohol use. And when you we talked about the stages that you talked about of kind of reaching addiction, but I'm thinking about it even in a more simple, from a more simple point of view, in that you have people, when we say it all the time, we make the statement, something happens, they're like, I need a drink.
I need a drink.
Right? And so it's become a part of what the response might be to stressful events, or, to dealing with managing certain issues in life, right? So, and I'm not gonna get too deep on this, but I'm just thinking about the myriad of things that can influence why we actually go through those stages. You might not even go through that experimental and social, and it might not even be that simple. It's so complex why we can end up in that situation, right?
You're right. I mean, so some people drink because of stress management, and they'll tell you, as you rightly said, I'm stressed, I need a drink, and they're gonna go and get that drink. And what's amazing is that it's hard to tell someone that alcohol drink does not work, because if it didn't work, you would not have been drinking. Okay? But just you have used, I call it neuroplasticity. Your brain has realized that anytime you stress, anytime you tired, anytime you want to celebrate, the only thing that's going to help you celebrate is a drink. So what about relearning those skills? What about looking for relearning something else to do except drinking? Because while drinking would help, temporary, it would help, it also causes physical issues like heart, lungs, kidney problems. It also impotence, and the list goes, heart attacks. So the list goes on, and the physical problems that it causes, and even the psychological causes. We're talking about the addiction, the craving, the withdrawal symptoms, the nausea, the vomiting, the irritability, the tremors. So would you really want to use something that causes those negative effects to
I don't
cope?
think that's what people usually think about.
No.
When they're thinking about coping, or when I think. Or this is more so opinion, and that by the time you've gotten to that point, sometimes you get to that point before you even realize it.
Yep.
Right.
That's right. When you lose control.
I don't. By the time I'm addicted, I feel like you've gotten to that point, and you might not have recognized that you have gotten to that point. But that's more like just kind of analyzing it. So when we think about alcohol abuse and alcohol addiction, what are some of the early warning signs that indicate a person may be progressing from casual drinking to addiction? And I feel like you touched on this a bit earlier when you talked about kind of how you can get to that stage.
Yeah, so when you lose control, when you realize that you are drinking more than you want to, that you're spending more money than you have to, when you realize that every day you're having a headache or you're having a hangover, you realize then that insightful that I'm losing control. And that's where you should start looking for help. And going back to historically, this is not new under the sun. The government of the day during the 1920s to the 1933 realized that making alcohol use without putting restrictions on alcohol, they realized that it causes the society problem. Hence the reason they prohibited alcohol at that moment. Now, so hence they put the restrictions on. Now you yourself have to realize that I'm losing control, and this is not. It's human to ask for help.
So what you talked about the individual, but what about like family and friends and even colleagues? What are some typical signs and symptoms that you would see if you recognize that, hey, my friend, my brother, my sister, my husband might be suffering with alcohol addiction? And I know that it could vary, so just some generalized ones.
In terms of family members, you may realize that your loved ones are becoming more agitated. You may realize that your loved ones may be becoming more abusive. Once you see 2, 3, 4 nights a week coming home drunk and saying that they're tired and they're frustrated, you realize that, my family member may have a problem and I need to look for help for them. In terms of friends, it's helpful to be truthful to your friend, because what's amazing about alcoholism, that you may not have a problem. You may be drinking with your friend and you may be still at the social stage, you drink now and then, but once you see that friend of yours increasing the amount of consumption, they can't control, they're not turning up to work, they're late, they're saying they're always sick and have a headache. Once you see that happening to your friend, you got to be real with your friend and have that conversation.
Yeah, that's interesting. Even I think about the employer component and wondering, because a lot of times, especially like if you're a coworker of someone, you don't want to overstep boundaries or say something that's not in your place. But when you think about signs and symptoms, I wonder what might impact the reason why a coworker might broach that subject. And sometimes it might be that you have to go to some, like your manager to get this person help. But also a lot of times we don't want we want to people please, so we don't want to do something that might hurt someone. And thinking that, okay, what can I do in a workplace if I recognize? Because like you said, this is Bermuda, and you talked about the individual that is not functional. But what about individuals who might be abusing alcohol, addicted to alcohol, and are functional on a daily basis?
Functional addict.
Yeah, but what does that look like in terms of some indicators that might tell a person, how can I help this person or convince them to get help?
When you talk about functional addict, you're talking about someone who goes to work, does the work, goes home, but the main issue is that their consumption of alcohol is increased. So the tolerance level is increased. When we talk about tolerance, we're talking about the ability to consume a substance and get the desired effect. So hence the reason 1 bottle of alcohol or beer doesn't help, 4 bottles of beers doesn't help. That person has to consume 12 beers or 13 beers before they start getting that desired effect. And sometimes the desired effect is not there. Okay? So to answer your question, how do you have that? You need to have that conversation with the individual. It is a difficult conversation, and they may go into denial and get angry because they're not ready to change. They're not ready to give up out there. They find that everything is fine, and if they can get away with drinking and coming to work, and they're not ready to change. But if you look at the quality of life, I
guess so. The main indicator for someone who might be functional, like a functional addict or alcohol addict, is that it's the level of consumption that you might view them having, or could it be like appearance or smell? Is that something that you would recognize?
Yes, that's a good point too. So you may or may not see appearance change. You may, according to who it is. And this is where we talk about the social determinants of health. So therefore, if someone is educated, they have a flying job, the way they will approach a functional drinker may be different. So they may want to drink in the closet. They may want to have a conversation. They may do that in secret.
So that wouldn't be something that might not be something that you recognize.
That you could recognize. But you would recognize when we talk about, you would recognize their increased consumption.
Okay, so when we talk about alcohol addiction, what strategies can be employed at different stages of addiction to encourage users to seek help? Because now we're at the point where, okay, you've gotten to that point, family members can recognize what alcohol addiction looks like. What are some strategies that you can employ?
Okay, when we talk about strategies, what has worked in therapy and treatment, a combination between psychological interventions and group interventions.
Okay.
And medication, also medication. So in terms of psychological interventions, cognitive behavior therapy, that's a therapy that helps correct people cognitive distortions. That means that you maybe someone may think or may have the wrong perception of how their life is for alcohol. Oh, I'm fine, nothing's wrong with me. But it helps the individual to see, no, I'm not bathing properly. I'm struggling. I'm not eating properly because I'm drinking. I'm not turning up to work. So all these things may flag for the individual while in therapy that, no, I'm actually in crisis. Then you have the dialectic behavior therapy, where dialectic behavior therapy is focused on the individual accepting where they are and then changing. Again, I said accepting where they are, and that's really powerful, because the only way you can change, you can't force someone to change. That person have to accept that I have a problem, and then that person gonna put things in place for them to change.
But how can you encourage them to actually seek these types of services? Because you're talking about these treatments, but even say, for instance, for example, myself, and I had a family member who, has alcohol addiction. Which strategies can I specifically employ to encourage them to actually get the help they need? Because again, like you said, you can't make an individual get it, but what can I do that might actually take them to the well and make them drink the water? Okay,
so you ask yourself, what is that individual core values? Some people core values are going to church. So therefore you may want the pastor to come and have a chat with them. Some people core values are, I respect, especially in Bermuda, I respect my mother. My mom is the one that really holds the family together. So you may want their parent to come and talk with, or the wife. Sometimes wives or husbands may need to set clear boundaries. Darling, I love you, but you're in trouble. So let's go and ask for help. Let's go and see a counselor. Let's go and start some level of addiction therapy.
Or even friends, because not everyone's married or has those right, partners or friends or important people in the lives, of the loved ones. I would say I think it's important for us all to think about how we show up for those people in our lives, even when they're in trouble, like when it comes to alcohol addiction. So we're now looking at the addiction component, but when we think about alcohol abuse, right, what does treatment look like? And I feel like you started to give us... Sorry, before we do that, you mentioned earlier about social economic status, and that's a concept that's also very near and dear to me as a person in public health, and with a health promotion background, which focuses on providing access to help by addressing the social determinants of health, right? So now we're looking at socioeconomic status, which is one of those social determinants of health, determine how we access, how we live and experience health, right? A lot of times. And so you talked about socioeconomic status, and when you referred to like what it might look like to see different types of functional alcoholics, right? So how does socioeconomic status impact the prevalence of alcohol use and abuse in different communities, and then more specifically in Bermuda, based on what you've seen?
Okay, so let's speak about two persons, John and Mary. Okay, so John came from a wealthy family. John is very educated. John has an exempt company job, and John is well supported. Okay, he had a mom, he had a dad, he had friends around him, very supportive. He has a very good Christian background, let's say, very church background, or he has a background where there are colleagues that hold him accountable. And let's look at Mary. Mary don't have a choice. Mary, dad left her, dad left the family. So mom had to do the same. Mom had to be a single parent for Mary. Mary at age 12, 13, Mary was pregnant with 2 children. Mary had to go through life. Mary was introduced to drugs. So she's a multi-user. She's not only used alcohol, she used drugs. But let's say alcohol is a main drug that she used. So Mary didn't have a choice. Mary was abused psychologically, physically. She's in a relationship where her husband beating her, where she has to go and look for a job. So let's say Mary has a job as a cleaner, and she feels that nobody respects her. 2 different persons from socioeconomic background. Now, John can easily say that, you know what, I have a problem. He doesn't want everybody to know. So he can pay for his treatment. John can go to one of the content facilities that we have in Bermuda and pay for his treatment, get his treatment privately, get a doctor to prescribe medication that can stop the urges of alcohol, or medication that when he drinks alcohol, he wouldn't feel the pleasurable part of it, or even medication which they call antabuse, where if he drinks, it makes him vomit, it makes him get headaches. So therefore, it's an aversion from using alcohol. So he has the money to get psychological treatment. He has the money to get medical treatment. He has a strong support system around him that will embrace him and encourage him and give him those values. You know, always talk, these are aspects of social determinants of health. All right. So John would have a fast, and John has the money to either go abroad or come to Dignity House and pay the highest the wellness program and get that help he needs. Yoga, Reiki, gym, counseling, group sessions, for 28 days. And after 28 days, John has realized I have a problem, and he put things in place. Mary doesn't have any money. To go to, if you're talking to Bermuda, to go to Turning Point, Mary, for alcoholism, if she's going through DTs and she reaches that stage, they will take her. So she's able to act, but there's a process to get there, but they will take her. And Mary can go through detox, but Mary doesn't want to do the rehabilitation because she's not educated in terms of the benefits. She doesn't read literature because maybe she didn't have that experience. Or Mary is in so much pain and abuse. She's in so much pain from an abuser that she's trapped, and he tells her, go to a detox, but I need you home after detox. Or if she doesn't want to go home, she has to go and take care of the children. Who's going to take care of the children? So Mary, because of her socioeconomic status, doesn't have any support. So therefore, her pathway as an alcoholic would be long, it would be dangerous, and she would not get the treatment she needs, or it'll take longer for her to get the treatment she needs.
So socioeconomic status looks at your background and in which you experience or have access to resources in society then. And I think even deeper, because the background that you indicated Mary has, all of those things may have influenced the alcoholism, right? But then again, those are two very different socioeconomic backgrounds, but two very different people, but they can both suffer from alcohol addiction, right?
Yep.
So in that we all have different reasons why we might end up in that situation, I guess, and that's the commonality. But when you look at social determinants of health, you talked about Mary coming from a one-person household, very little money, and then how that can then affect your access to treatment. So how can public policy initiatives address the socioeconomic factors contributing to alcohol abuse in these areas, in terms of addressing situations where you have those very different? And I know we have some organizations here in Bermuda, but to get through that entire process of treatment.
Government policies are critical for treatment. One of the main policies we're looking at is access to funding. If Mary gets funding, she can access treatment facilities. And in Bermuda, there's a number of treatment facilities that can support people like Mary. Bermuda has done very well when it comes to that. We have the Women Resource Centers. We have Women Treatment Center. We have the FA financial assistance that can provide some level of support for Mary. Obviously, I would say Dignity House. We're here to help rehabilitation, and we focus on both psychological and substance misuse, getting people back on their feet. So in Bermuda, there's a lot of treatment facilities. And if Mary is not ready yet, she can go to one of the AA groups, which is Alcohol Anonymous groups in society. In Bermuda, and there are a number of them in different locations, where can support Mary and let Mary know that she's not alone. That's why group therapy is so powerful, because Mary may think she's the only person going through this and she can't handle it as a woman until she meets another woman like her, Jane, like her, with similar stories, who have been through recovery and now 10 years clean, 12 years clean, and back on her feet and working, and Mary can find support and grace through that.
Okay. And so as we think about alcohol awareness, right? What are some of the evidence-based treatment options available for individuals struggling with alcohol addiction?
The main one that is used internationally is the 12-step program. The 12-step program, which helps people to understand that they're powerless behind the drug, and it really lets people know that it's not you that is a bad person, it's that you've lost control, and you need to give up that control to a higher power, may it be God or may it be a system, for it to work, because you're doing it by yourself for so long and it's ineffective. So the A program is awesome. There's some 12-step program also, helps people to change psychologically in terms of making people accountable for their wrong and saying sorry, and even helping others to become a better version of themselves.
Making amends. And I guess I would think of it as more like self-evaluation and recognizing where you are and what you do have control over and what you can do.
Yes.
Okay.
Yes. I must push on to say that, with the AA program, with alcohol, like other drugs, there's a 3 to 5% success rate. And we're having some clients now through our program that's saying, they're tired of the AA program because it hasn't worked for them for years. So the bigger question is, what else is missing?
So what other...
I think dialectic behavior therapy is the missing piece.
Dialectic behavior therapy? What is that?
So it's a talk therapy known as DBT, dialectic behavior therapy, that focus on 4 main areas: mindfulness, staying in the present moment. Because if you go too far in that moment, you have anxiety. And if you stay too behind in that moment, you have pain and regret, so it's about living today and learning to live today, learning to live for that moment. And that's really critical when you're dealing with addiction, because there's so much guilt and because of all of some of the risky behaviors that people encounter while in that addiction. The next part of dialectic behavior therapy is emotional regulation. How do you manage those emotions? How do you manage those cravings? How do you manage those instant gratification? I need it now. I'm stressed, I need a drink now. How do you go through that and manage those emotions? So it helps you to teach you to manage those emotions, emotional regulations. You have the stress tolerance. Things happen in life. And when things happen in life, for an addict, the first thing is, I want to drink.
Right.
Yeah. I need a drink now. Where's the first bottle? So it's how do you feel the stress and able to hold on to that distress and know that it will get better. Things will get better. The last part of it is interpersonal effectiveness. So interpersonal effectiveness focus on communication. Because as an addict, you learn to manipulate to get what you want. You learn to minimize or catastrophize things to get what you want. And that may also affect people you love. There's a lot of persons who have addictive family. A lot of addicted persons who have family who has said, I'm tired. I can't do this again. This has been years, and every time I put myself out there, I lose money. I'm hurt because this person goes back to the same cycle. And interpersonal effectiveness helps the addict realize that they are part of that issue. It's not your mother because she don't want to give you money to use drugs. It's not your friend because you curse them out or you're agitated. I am part of that process. And how do I start to mend those communication levels?
Right. Okay. Thank you for sharing that. So when we think about other approaches, and I think I feel like you mentioned some of these earlier. What about MAT, medication assisted treatment? Because you mentioned that one. You mentioned a couple of those earlier when we talked about what John might have access to versus Mary.
Yes.
Right. So what does that look like? Is that something that's accessible in Bermuda?
Well, definitely. I would like to start with detox. When you're talking about medication-assisted treatment, what alcohol does, it passes through the blood-brain barrier in your brain, and it becomes part of your system. So it becomes part of your normal regulating system. So therefore, if your car do not have gas and you turn in your key and you realize, oops, it's not going anywhere, So your body now start calling for the alcohol when you don't drink. And you start basically getting signs and symptoms between 6 to 12 hours of not drinking. Could be much sooner. And people soon start to go through that withdrawal symptoms. So the only thing can stop the tremors. And let's talk about the tremors a bit. So your tremors starts with your fingers and your extremities, and then it starts with your hand, and then your tongue, and then your inside starts to shake up. That means your lungs, your heart, so your internal organs start to shake up. And if you don't get another drink within 12 or 48 hours, you can die.
Wow. I was going to ask you, like, what can come of, like, experiencing alcohol withdrawal?
You can die. So it's fatal. Hence the reason treatment facilities, they prioritize persons who have alcohol, who are alcohol abusers. So what happens in medication assisted therapy, they use diazepam or Valium that helps people. So two things will help: either another drink, which we don't want, we want to stop drinking, or you go and doctor prescribe Valium for you, or diazepam, which helps you reduce the tremors, and it's prescribed on a sliding scale. So it helps reduce the tremors, and while it reducing the tremors, they'll have your vital signs, you'll be consistent on medical assessment until you can get through that period safely. The time period basically is between 7 to 14 days.
To go through that detox
yes.
Stage?
Yes.
Okay, so when we come full circle for our conversation now, we've looked at kind of the impact of alcohol on our society, and then how it can impact our individual, and how it can become, alcohol addiction. And now we're looking at treatment processes. So I just want to know a bit more around Dignity House and the role you play in Bermuda society, the services you have that people can access, and how can people contact you to try to access those services?
Okay. So at Dignity House, we presently have 3 main services. I mean, four main services. The first service is the rehabilitation process, where we take clients between a period of 9 months to a year, and they go through 3 programs within 3 processes within our program. The first part is the residential phase, where we have intensive groups. You see the psychiatrist, you see the psychologist, you see the occupational therapist. So that's every day, Monday to Friday, every day, that bombardment of the brain. And after you start engaging the brain that much, between 6 to 8 weeks, people start to change. And we've had clients who have 30 years, 40 years, 50 years in addiction. Right now, they're out, they're in society, they're working, they're their best version of themselves through that process. If you look at the Royal Gazette last week, we celebrated 3 years, and we had one of our clients who have done approximately 30 years in addiction has said, showcasing herself and saying, you know what, I've done it. I am working now, I'm engaging, and I'm free. So rehabilitation is possible. The second phase is the supported living phase, where you have more access to the community. And in that access to the community, some people go back drinking. All right, because that's what it's all about. It's that process where you can test your strength. You can, and if you make a mistake, or if you fail, you have that support. You come back, staff talk to you, we do the therapy, you go back again. So that is that phase where you start engaging, but engaging with support. And the last phase is the independent phase, where people are allowed to work. We try to find accommodation for them, and they're still in therapy, they're still getting that support, but the support is less support and more access to the community and engaging, and then we discharge. So it's a process where we hold people's hand and then get them back on their feet.
I love that, because, sometimes a lot of times you watch the movies, or, you see you think people just go into rehab and that's it.
No.
But it's a continued support that is needed to help persons get back to a stage of kind of functioning, but also learning how to live with the fact that they have alcohol addiction. So how can I go back into society and actually, survive or function knowing this now. So how can people contact or get access to your services? How does that work?
So you can email us. You can email us at RIE at dignityhousebm.com, or you can call us at 333-6095.
Okay.
Or you can visit our website and you'd get directions there at www.dignityhousebm.com. Most of the time I tell people just Google Dignity House Bermuda and it will pop up on Google.
Yes.
I mean, having said that, we have 2 more services if I can share.
Yes, please.
If I can share. So we have the wellness program, and the wellness program, it's a mix between psychiatry, the aggressive approach, psychiatry, psychology, occupational therapy, recreational therapy, yoga, gym, and that focus group on deep dialectic behavior therapy, together with concepts of the AA program, the 12-step program, and the metaphysical approach. So we've had, and that will be yoga, that'll be Reiki, and we have some other metaphysical approaches that we use. Meditation, acupuncture. So all those are things that we offer to help people. And that program is basically a 4 to 8 weeks program where people are working and people want to take 2 off from jobs and they're in crisis. They can come in and we can follow you up. We can follow through with you through outpatient basis. And the last program is the detox alcohol and opioid detox program that we have, where some people think that if it's not MWI or Turning Point, we have to go abroad. So we provide that option that you don't have to go abroad, that you can come to us and get the help that you need.
Thank you for sharing that. It's good to know that there are other resources in the community. So if you had to leave one more thought or piece of food for thought for our audience before we go, what would that be?
Do not give up. If you in the community and you found yourself struggling with alcohol, do not give up. It is possible. Your present position is not your final destination. Where you are today wouldn't be where you are tomorrow, next week, or next year. Take the step. Ask for help. There's something we say in Dignity House every day, and that's our motto, is that I can, I will, I must. I am my own rescue. Nobody else, and you are a force to be reckoned with.
Thank you so much. That gave me chills. So I want to thank you so much, Nicholas, for coming on and sharing your background. Yes. Thank you to Dignity House in general. And I want to thank our listeners, our Bermuda Health-Abetters, for coming on and listening to this very important discussion. And if you would like to tune in to more episodes of Bermuda Health-Abets, you can find it on Department of Health's Facebook page at Department of Health Bermuda, or our YouTube channel at Department of Health Bermuda. If you have a topic that you're interested in or a question that you'd like to see answered on Bermuda Health-Abets, you can email healthpromotion@gov.bm or call 278-4900 and ask for the Health Promotion Department. Thank you so much for listening. Have a great day.
You have been listening to Bermuda Health-Abets. Please note, anything you heard on this podcast is not a substitute for visiting your healthcare provider. If you have a topic or want a question answered, please contact the Health Promotion and Wellness Office of the Department of Health by emailing healthpromotion@gov.bm or by calling 278-4900. Be sure to listen out for the next episode of Bermuda Health-Abets.